Mr. President, let me, if I can, address once again, this issues here that need to be clarified, because again, we have disagreements about the health care bill. That's nothing new at all here. But I want the record to reflect the efforts that have been made for over a year now to involve our colleagues across the spectrum, beginning with my predecessor, who would be otherwise standing at this very podium, but for his own illness and his death, Senator Kennedy. His office began, and his staff still works with us, and will more than share the details of those meetings that occurred beginning about a year ago to formulate the very bill which we're grappling with today. I was not a participant in those early meetings. Senator Kennedy was, with his staff and members of the minority staff, right after the elections as well, and then began to work in his place starting around the first of the year, shortly thereafter. There were numerous meetings between members from across the spectrum here, from the Budget Committee, the Finance Committee, the Health Committee, countless meetings of staff in all three of these committees. Many of them occurred in Senator Baucus's office, the chairman of the Finance Committee. I will lay out, in fact, in details, the hearing process. Now, the battling over the substance of the bill is a very legitimate process. That's what this engaged in. There are 100 of us here representing various constituencies and various ideas. There's nothing inherently wrong about that. In fact, it's a healthy process to go through. But I can't stand here and accept the notion that people have been excluded from a process. That's just not the case at all. Now, there are times when the majority here that has the responsibility of proposing ideas will meet together to formulate an idea to bring it forward, or a series of ideas that come forward. We're acting as substitute. This is an historical, unprecedented occurrence that defies anyone who has known 5 minutes of the history of this institution to tell you historically. I recall only a few years ago when the majority leader and others were excluded from conference meetings between the House and the Senate. If Tom Daschle showed up, the word was, the conference committee would be canceled. Imagine the majority leader as a conferee dealing with a bill between the House and the Senate would show up, the meeting would be canceled. Now, so I all due respect, it's that old line of Claude Rains in the famous movie of Casablanca, walking into Nick's Cafe and looked around with Humphrey Bogart standing there and said, "Is there gambling going on in here?" Shocked to believe that such a thing. Is politics going on in the Senate? Yes, it is. And it has been since 1789, Mr. President, going back to the founding of the Republic. Politics has happened in this institution where people try and formulate these ideas to bring together on behalf of our constituents across the country. And it needs pointing out, as I will, and lay out and provide shortly, every single amendment offered by the other side. Hardly technical, so that everyone can read it here. The provisions in this bill that were specifically offered by members of the minority that were accepted either in our committee or in other places here, reflected in the substance of this bill. Is it their bill? Well, no, obviously they haven't voted for it, but a lot of the substance in the bill is theirs. And to suggest otherwise is just untrue. The notion somehow people have been excluded from this process is just not the case at all. In fact, going back, if you will, and since January of 2007, since I was become sort of acting chairman of the committee, the Health Committee held 30 bipartisan hearings on health care reform, with 15 alone in 2009. Taken together, the Health and Finance Committees held more than 100 bipartisan meetings. Beginning in December of 2008, the bipartisan leadership of the Health Committee, Finance Committee, and Budget Committees met 10 various times to discuss health care reform legislation. Staff met even more frequently, Mr. President. Ideas discussed in those meetings are reflected in this bill. In 2008, the Health Committee held 15 bipartisan health reform staff roundtables, which included Republican and Democratic staff from the Health, Finance, and Budget Committees. Over 80 stakeholders from the pharmaceutical industry, the insurance industry, those who advocated single-payer approaches. 80 stakeholder meetings were held in the health care debate from across the political spectrum. Democrats, Republicans, patients, providers, employers, unions, insurers, drug device manufacturers contributed recommendations to this bill. Now, they weren't all accepted. The idea that we take everyone's idea that comes to the table is ludicrous on its face. But certainly the opportunity to affect the outcome of this bill was a very much of an open process. In addition, committee staff held regular meetings with smaller representative groups. Since April of 2009, these meetings included staff from Senator Enzi's office, Senator Gregg's office, Senator Hatch's office. These meetings included groups from across the political spectrum who met for 2-hour sessions twice a week to provide detailed and thoughtful contributions to this bill. In addition to these stakeholders, hundreds of groups attended larger stakeholder meetings on March 13th, May 15th, where further recommendations on reform were heard. On June 10th and 11th, Mr. President, prior to the beginning of the markup of the Health Committee bill, members had detailed bipartisan discussions of the draft legislation, including extensive options contributed by our Republican colleagues. Options provided by Republican members were reflected in the legislation approved by the committee. On June 22nd, Mr. President, Health Committee senators also met with the nonpartisan Congressional Budget Office, Director Doug Elmendorf and other CBO staff to go through the process. This is before any markup began on the bill at all. And then the markup itself lasted for almost a month, a record for that committee in its history, by the way. The committee held more than 56, almost 60 hours of executive consideration of the legislation, stretching across 23 different sessions over 13 days. Taken together with the Finance Committee, more than 20 days were devoted to the amendment process alone. During the Health Committee markup, and I've mentioned this over and over again, we considered 287 amendments, almost 300 amendments. 161 of those 270 were accepted, Republican amendments of the 287. And I'm going to ask all of those amendments that were accepted and the description of those amendments be included in the record, if I may. We'll send that to the desk for inclusion.
Without objection.
Specific pages of this bill, the language of these amendments, or a synopsis of the language to be included. So you can just read these. Just weren't technical amendments. Let me mention some of them, if I can, that were included. Our colleague from Georgia, Senator Burr, offered amendments subjecting the public option to to the same laws and requirements as private plans. This discussion, we weren't involved in the public option. Here are amendments being offered by the Republicans, accepted in the committee, dealing with the public option. Now, do we take all of them? Of course not. But again, of the 287 amendments, North Carolina, of the 287 amendments, 161 of them, as you'll now read, were reflected in these efforts. The follow-on biologics, Senator bipartisan, Senator Enzi, Senator Hatch, Senator Hagan, Democrat, Senator Hagan, obviously, and Senator Hatch and Enzi, Republicans, offered amendment to establish the pathway for biosimilar biological products. This Republican amendment is reflected again in the bill, page 1859. Long-term care. Senator Gregg ensured that the new voluntary program to improve long-term care options will remain solvent for 75 years. The Class Act, again, reflected in this bill on page 1931 of the bill. The prevention, again, a bipartisan amendment offered by Senator Gregg and Senator Harkin, expands and strengthens the incentives available for participation in workplace wellness programs. Again, reflected in the bill on page 80. The Murkowski Amendment, Lisa Murkowski of Alaska, would allow insurance companies to offer discounts for those who do not smoke. This Republican amendment, again, on page 80 of the bill, reflected there. Coverage, several amendments offered by Senator Enzi, Senator Coburn, and Senator Roberts, and others to make certain that nothing in the legislation would allow for rationing of care. No one will be denied care based on age, disability, or medical dependency, or quality of life. Page 105 of the bill, that is reflected as well. My colleague from Wyoming, the ranking member of the committee, 41 different amendments, Mr. President, that were included in the bill as well, dealing with a public option, for instance. Here on Title I, Menzie Amendment number 241 on page 185 of the markup bill, line 22, to ensure that individuals enrolled in the community health service option have access to all services. Senator Enzi's amendment included in the bill. He offered amendments on page 272 to prevent denial of care based on patient age, disability, medical dependency, or quality of life, the anti-rationing proposals. Follow-on biologics, his amendments. Amendments to protect and ensure that data in prevention programs includes rural populations. Again, I'll provide a list here of the 41 amendments, and my colleagues or others can read a synopsis of those amendments. Hardly punctuation marks in the bill. Now, you may not agree with everyone. We accepted them. I thought they contributed to the bill, made it a better bill. I don't decry them at all. I welcome them as ideas. So the suggestion, again, that somehow this has been jammed down the throats of people, that secret meetings going on, I don't think that people ought to engage in that. You can vote against the bill if you want here, but don't suggest to me that this process denied people a chance to be heard, to be involved, to be engaged. I went out of my way in that markup of that bill to stay for as many hours as people wanted to, for as long as they wanted to offer as many amendments as they wanted to. And staff worked all during the weekends of that process to go through these amendments and accept. I remember on one occasion I proposed accepting, after the work over one weekend, I think it was 40 amendments. My staff will correct me if I'm wrong, something about 40 different amendments, and I offered to accept all 40 of them, and my Republican friends objected to a request to accept their amendments in the committee at one point. So the notion that we marked up titles of this bill without adequate notice of language, I insisted that any amendment, before it could be offered, had to have a CBO score, Mr. President. So no matter how good your amendment might sound, I wanted to know what the financial implications were going to be of your amendment. A Democrat or Republican offering an amendment had to have a CBO score. And so the idea that we wouldn't, without notice or of language or CBO scores, again, is false in the markup of our bill. The markup dates were postponed by me to allow more time to read language, to ensure CBO scores were distributed to all members as well. So not just amendments, but titles to the bill had to be scored. We didn't insist that amendments, excuse me, I said amendments, I meant the titles of the bill be scored in the bill. So that, again, you took all the amendments as part of the financial implications were going to be. So again, Mr. President, as someone here, I know, having been around here a number of years, I know when there's a true willingness to have a bipartisan effort. And I know when there's one that is not going to happen. Senator Kennedy understood that as well, and I've had numerous bipartisan agreements with my colleagues on committees I've served on over the years. And it's certainly far better when you can achieve that. I don't deny that at all. But I will not accept the notion here that there's been a refusal to accept or willing to listen to bipartisan ideas as part of this bill. Now, again, there's a debate I know going on the other side as to whether or not to have amendments or not have amendments, and whether or not Rush Limbaugh is controlling the show or the Republican leader, and those things happen. I understand that. But the fact of the matter is we have a bill here, far from perfect. I'll be the first to acknowledge it. Not a bill I would have written on my own, but we serve in a body of 100 co-equals that bring to our debate and discussion the various backgrounds, experiences, our viewpoints. It's not an easy task. And the reflection that every other Congress going back to the 1940s, to one degree or another, has tried to deal with this issue. Every administration, from Harry Truman through every Republican and Democratic administration since the 1940s, have to one degree or another grappled with this issue of health care. And to a large extent, everyone has failed at this or has not tried, because it has been so monumental an undertaking that has been daunting. And certainly we're seeing that as we grapple with this in our hour of watch, if you will. When those of us who are privileged to be here, serving with an administration that has made this a priority, we've been challenged to do what no other Congress and no other administration has been able to achieve over the past 70 years. And we are close to achieving a major beginning. And it is a beginning. Anyone who suggests otherwise doesn't understand the complexity or the largeness of this undertaking. A beginning to begin to change and bring down costs, increase access and affordability, as well as the quality of something that ought to be a basic right in the United States of America, and that is health care. And I am excited and optimistic about the possibility of achieving that. It is less than what I would have wished we could have done, but it is far more than has ever been achieved by others. And the product that you have before us, while it's not one that's been endorsed on a bipartisan basis, reflects a lot of good contributions made by all members. In fact, every single member of the Health Committee, every single member offered amendments that were adopted as part of our product, every single one. And substantive amendments were offered as well. The fact that they don't want to admit it or acknowledge it. In fact, I find it somewhat intriguing that people feel excluded from the public option idea. I had no idea they were interested in one. It's exciting to know that maybe there's some ideas they had on a public option. The reflection that occurred during our debate discussion was they were totally opposed to any public option in this bill. And so we adopted one as part of the Health Committee process under the leadership of Sherrod Brown and Sheldon Whitehouse and Kay Hagan of North Carolina. that sat together and working with others outside came up with an option that we thought would appeal on a bipartisan basis. It did not, and we're very much involved in that debate as we speak. But again, the reflection that they were never involved in the public option, again, there was vehement opposition to any idea of a public option from the Republican side. However, I do mention there were some amendments offered to the public option proposal in this debate and discussion, which are reflected in the final product. Anyway, Mr. President, I just wanted to respond to these earlier suggestions, and I'll leave them as suggestions, that somehow this product and process was been totally written on a partisan basis. It is anything but that. And I want the record to reflect that, hence the decision to include the specific amendments, the pages on which they exist in our product, and the substance of ideas that were contributed by our Republican friends.